This is Providence Television International, the game changer. Stand by for the next program. Well, welcome to the program, all our viewers at home and all over the world. This is Providence Television International. My name is Emmanuel Egariba, and the program is Women's Health. This is the debut program, the first in the series of this program, and we're happy that today we have fulfilled our promise. We said to many women who phoned in that we're going to start it off very soon, and that's what we are doing right away. And today we have with us on this program as guest a renowned professor of obs and gynae, in other words, obstetrics and gynecology. Professor Alfred Ehigegba is retired from the University of Benin and also the University of Benin Teaching Hospital. He is the co-founder, at the moment, is the co-founder of Ebony Medical Center here in Benin City. He will be telling us about this subject matter for today. And what is the topic? The topic is infertility. Infertility has become a very well-known subject in medicine. So, Prof, let's welcome you to this television station.
Thank you very much.
Thank you very much indeed.
Yeah.
Thank you so much.
Thank you.
Yes, we must start from where people think we should start from.
Okay.
What is the definition of infertility?
Yes, infertility definition has changed a little bit. When I was a younger medical student in the 70s and 80s, a medical doctor, infertility was defined, so we were taught, as the inability of a woman to be able to achieve a successful pregnancy. Not that the woman must be pregnant, but the pregnancy must be successful. Within a period of 2 years of trying.
Just 2 years?
2 years.
Okay.
If you have been trying for 2 years and you have not been able to achieve a viable pregnancy, we say you have infertility. But over time, the only thing that's constant in this world is change. This definition has changed. Today, if you tell a woman to wait for 2 years before we begin to find out why you are not pregnant, I mean, she won't accept it.
Oh, really?
Yes, she won't accept it. Every woman who thinks, I should have become pregnant, I'm not yet pregnant, is a woman who is under stress.
So what time frame are they looking at?
We are now using 1 year.
Oh, really? Okay.
No more 2 years. Even the 1 year is with a bit of, yes. If a woman comes after 6 months of marriage and she is not pregnant, you won't send her away. You will listen to her. You will ask her questions. You will examine her. That is it. So, I don't know. I think I've dealt with the definition of infertility.
Yes,
yeah.
You have.
Okay.
Is infertility restricted to just women or also men?
That it is treated or?
Restricted.
Yes.
Is it only for women or also for men?
It takes a normal or healthy husband and a healthy wife to produce a baby. Even when they are not married, it takes a healthy woman and a healthy man to produce a baby. Unfortunately, the society looks at infertility more like the problem of the woman. It is not the problem of the woman. In fact, infertility is caused. If you look at 100 couples who cannot become pregnant, and you find out, you do the test to find out why, it's only about 34% of cases you will find that the woman is responsible.
Oh, really?
In another 35% of cases, the man is responsible. So the man is as responsible for infertility as the woman.
Why is the woman always at the receiving end?
Because of our society.
Okay.
Because of our society. The society looks at the woman as the person who produces the baby. But the woman is just acting as a habitat, the place where the baby is formed. The egg that fertilizes the egg of the woman comes from the man. So so many things can be wrong with the man, just like so many things can be wrong with the woman. In another 34% of cases or so, either we find nothing wrong with the two of them, or there is a problem with the two of them.
Okay.
In other words, infertility or having a baby or becoming pregnant is more like a game of chance. And we always say this, that you must allow, you see, the woman ovulates only once in a month, once in 28 days on the average. And that is the only time she produces the egg. The man, on the other hand, anytime he ejaculates during sexual intercourse, pours out millions of male eggs. That's why many of them flow out after sexual intercourse. And some women will come and tell us that, oh, anytime my husband releases inside me, everything flow out. It's not everything. Can never be everything. Because the male egg is quite capable of doing one thing, and that is swim. The male egg swims. In fact, it's been calculated that if the male egg were as big as a human body, it will make the 100-meter dash in 1/3 of the time the average or the Olympic champion makes the 100
In other
meter
words,
breaststroke.
it thrives on speed.
Yes. So the male egg can swim and is very powerful as doing that. However, the female egg does not move, has no ability to move, so it must be carried. So when it is released from the ovary, it is picked up.
Yes, can we see the ovary there? Yes.
Yes. It is picked up by the fallopian tube.
Okay.
And inside the fallopian tube, there are finger-like processes.
Now, which is the fallopian tube?
The one on the left.
Okay.
Where there are two fallopian tubes there.
Oh, yes, that's true.
And they are both, yes, the fallopian tubes, the one that ended as a funnel.
As a funnel.
Yes, that's a fallopian tube.
Yes.
So, and it moves, it sweeps round the ovary. The ovary is the one just by it.
Just by it, yes.
When the egg is released from the ovary, the fallopian tube picks up the egg. It's like a sucking in process. And once it is picked and put into this fallopian tube lumen, the finger-like processes are like the canoe paddles that canoe men use to move in the water. That is how the female egg is moved from where it is released up to about halfway in the fallopian tube, where the male egg will meet it and enter it and fertilize the female egg. So you find that there are many steps that will have to be taken or will have to take place before a woman gets pregnant. Number one, let's start with the woman.
Yes.
The woman must be able to release one egg every month.
Just one?
Just one. That's the way God made women. One egg every month. And the woman's egg must be picked up by the fallopian tube. And the fallopian tube must be able to transport the egg towards the uterus.
Yes, let's see that again.
You know, the fallopian tube must be able to transport the egg towards the cavity of the uterus.
Of the uterus, yes.
It is in that process of the fallopian tube going towards the uterus that the male egg that is released into the vagina will swim through the cervical canal or cervical os. So you have the external os showing there and the internal os. That the distance between the two of them is called the cervical canal. And in the cervical canal, the mucus are secreted. A mucus are slimy, is a kind of slimy fluid. And the mucus actually acts as an obstacle to the movement of the male egg that's deposited in the vagina. And the mucus will have to be, you see, the male egg is equipped with enzymes in the head. And the enzymes digest the mucus to create or pave way for it to move forward. So that short distance of the cervical canal it will take the male egg 18 hours to transverse it to get into the uterine cavity. Once the male egg gets into the uterine cavity, there is in an Appian way. Nothing stops it
Nothing
again.
stops it, yes.
It's moving very well, and it goes into the fallopian tube of those side. It doesn't know where the egg is, and then it's looking for the egg to fertilize. So it's the male egg that does all the job. The female egg is dormant. It just waits. And all these steps must take place before a woman, when the male egg is, and female egg is fertilized by the male egg, it must be transported further into the cavity of the uterus. It slides down the wall of the uterus, and then it goes stuck and gets fixed. That is where the placenta is formed.
All right.
And that is what we call implantation.
Okay. The other word for uterus, can it be the womb?
Yes, the uterus is the womb,
Beautiful.
sorry.
Beautiful.
So there has to be, is the implantation will take place, where the placenta is now, where the egg, fertilized female egg is stuck to the internal lining of the uterus. And then it begins to develop. And it begins to develop. Where it is holding on to the uterus, placenta forms there.
Oh, really?
And then the baby begins to develop in a sac. Now, we say the woman is pregnant. You do an ultrasound scan, you see the sac.
Beautiful.
You see the baby inside.
Beautiful.
And from about 8 weeks, you will see the heartbeat of the baby. And you say, this is a viable
couple of months.
pregnancy. Yes.
Yep.
So 8 weeks. When this has happened, we say the woman is pregnant. Pregnancy test will be positive. But look at the number of steps that has been transversed by nature. Male egg must be released. The male egg must have the ability to swim. There must be quite many. That is why when a man releases like 3 males or 4 males of egg into the vagina of the woman, if you take 1 male and you assess how many male eggs there, it's anything between 10 million and 200 million.
That's right.
In 1 male.
That's right. That's right.
So you therefore find that...
So there's no redundancy, really. There shouldn't be.
Well, you need only 1.
Oh, just 1, yes.
To fertilize the
yes.
the egg.
Oh,
But
yes.
all of them, plenty will move out after intercourse, but all of them will try. They help themselves when they swim. Together, they move faster and they get to the destination. That is why when the egg concentration is less than 10 million in a man, we say, well, that's probably the lowest limit. That 10 million is the lowest limit that we
That's what you call
normal.
a low sperm count?
Yeah.
Is that what you call low sperm count?
Yes, that's what they call low sperm count. But you see, low sperm count is a relative thing. Then you have to look at what percentage of the cells can move and what percentage of the cells are normal. So these are all the problems that are associated with male infertility. If a man, that's why when we are looking at why a couple is not pregnant, the test we do for the man is just 1. That's sperm count.
Oh.
And it's so easy to do. It is not invasive at all. Whereas if we are to look at the woman, there are so many tests that we have to do. Many of them are invasive. There are some we may have to even take the woman to theater to do a test. So infertility, therefore, means that all these levels must be crossed. Hurdles you must scale them, and it may therefore take sometimes up to 5 years.
Really?
For a woman to achieve a pregnancy, even though nothing is wrong with her and nothing is wrong with her husband. That is why I used the word a few minutes ago that fertility or pregnancy occurring in a woman is a game of chance. It's like you are playing Ludo game. You don't decide what you get. But when you play and the dice stops rolling, you look at what's on top. That's your number. You don't get a 6 when you want to have a 6. No.
Oh,
it is nature.
Prof, this is quite amazing. This is quite amazing.
Yes.
In other words, any woman that gets pregnant on the basis of chance.
Yes. Yes. Even IVF, when we take the egg and inject it, male egg, and inject it into the female egg, that is like saying, oh yeah, fertilize it, you are here now. It doesn't always fertilize.
It doesn't always.
Yes. Always, no. The rate of fertilization is almost like the rate of natural pregnancy, but it is higher when you're doing IVF. So I don't know which question I'm answering now. But
well, it's not been lumped up together, but I'll
Yeah.
pick you on. I'll pick one of the issues you raised.
Yes.
For the man, in other words, what you have said is that when you are treating the woman, you must also make the man available.
Yeah,
So you
yes.
treat both of them at the same time.
Yes. In fact, when a woman comes to our hospital to complain that she has not been able to get pregnant, ideally the husband should be sitting with her.
Okay.
Whatever you are telling the woman should also be entering the ears of the husband. Whatever test, and then you tell the husband that I want you to do a simple test. It's not very invasive. That's where we start from. The husband's simple test. Because at the beginning of this thing, you told our viewers that infertility is generally viewed in the society as a problem of the woman, and I agree with you. And I said that is because that is what we think, but it is not. It's the same number of women and men out of 100 couple that we have problems with fertility. Same. So when we look at we start off with the man, and then we will now begin to take the female investigations one after the other. We stage those ones out.
Now, what are the people most vulnerable in all of this?
Where are you mean the common causes
Yes.
of infertility? So when we come to common causes of infertility, we will now say that we know there are two sources. We have to now define the infertility. We have to say common causes of male infertility and ask common causes of female infertility. They are both different. Male infertility causes infection, can affect the testes and interfere with the production of the eggs. The male eggs are produced in the testes. When there are other things that can affect the production of the testes. Fortunately, not very common is the one where whatever egg is produced in the testes is an egg that is not, or there are no eggs at all in the testes. The man is, such men are usually very handsome. They have a condition we call the Klinefelter syndrome. And the chromosomal this thing of the eggs is very well defined. It's XXY, I think, yes. And such men don't produce eggs. Therefore, they can never produce babies. Their testes do not produce eggs.
In other words, they are impotent?
Yes.
Okay.
That's what it is.
Yes, okay.
But in being impotent doesn't mean you cannot have a child.
How?
Just like you can donate blood for me. If my blood level is so low and we have the same blood group. Yeah. That is why those who manage fertility can accept egg donors from a third person and use in assisting a couple. So now we're talking about the male. There is a long tube that goes from the testes up to the penis. We call it the vasa efferentia, or we just call it vas. That's the name of the tube. It is inside the lumen of those tubes that the eggs that the testes produce or manufacture, they will have to come through there and come out and enter the vagina of the woman. Unfortunately, there are two, one on either side of the body, but the two can get blocked.
Okay.
and
Okay.
as a result of infection. And then there is no egg in the semen that is produced by the man. And of course, there can be abnormalities of the sperm that will make the sperm unable to fertilize a female egg. And these conditions are so many in men. Sometimes we have to appeal to men, because most Nigerian women will come alone to the infertility clinic.
Okay.
We will tell them, why didn't your husband come with you? Oh, he has no time, or he is very busy. All right, I would like you to give this paper to your husband to go and do this test for us. I will give the woman the request form for the husband's seminal fluid analysis. And the husband, if he say, I don't want to categorize men here, but there are some men who will just take the paper and go and do it.
Good.
And then they bring the results.
Okay.
And we're able to analyze the result, and we're able to give an opinion. But there are some men who will throw the paper back at their wife and say, go and give that to your doctor. Tell him I am normal. Very arrogantly. If you are normal, prove it that you are normal. The test will just prove it.
Okay, that's right.
It doesn't take 20 minutes to do the test. So those are the things we find out about men. Women, very many things that can be wrong with a woman. Starting from the ovary. The ovary may not be allowed to produce eggs because of certain factors are happening around the ovary.
Okay.
In the brain, there is a gland at the base of the skull called the pituitary gland. It is that gland, as it's called, the master gland of the body. That gland controls all the other glands of the body, including the kidneys and the ovaries.
Really?
In fact, the ovaries they depend on the pituitary hormones to produce normal eggs and to produce normal hormones. There are two main functions of the ovaries in women. One is to produce eggs, and the other is to produce female hormones. Those are the two functions that the ovary have. But these two functions depend on the pituitary gland at the base of the skull.
At the brain, yes.
Producing the hormones that will be controlling or directing the ovary, which direction. If anything is wrong with that link between the pituitary and the ovary becomes useless.
In other words, infertility can also be as a result of hormonal imbalance.
Yes.
Okay.
That is what people call hormonal imbalance. But we are very careful using the word imbalance. We assess the hormones, and we say if there is a problem with the hormone, we call it hormonal problems, not hormonal imbalance. So you can have that at the pituitary. Then at the level of the ovary, there can be illnesses or pathologies or diseases of the ovary intrinsic in the ovary that will prevent the ovary from manufacturing good eggs. Those ones are very, very rare. And then, of course, once the egg has been produced by the ovary, and they are picked up in the fallopian tube, that's where the second group of problems in women will come. The fallopian tube. The fallopian tubes are long structures, and about 8 centimeters, 6 centimeters. And they all have a lumen. The lumen must have these finger-like processes I talked about. We call them filia. And these finger-like processes project into the lumen. Unfortunately, if there is an infection of the fallopian tube, these finger-like processes are the first to be completely disabled. They go, and when the fallopian tube, even though it is patent, the hole is not blocked, but the finger-like processes are not there, then that fallopian tube is not functional. It cannot paddle or carry the egg, and therefore infertility can occur. Or if the male egg is able to walk the longer distance and reach where the fallopian tube, where the egg is in the female, and is able to fertilize the egg, then the movement of the fertilized egg towards the uterine cavity or toward the uterine cavity can be so delayed. A fertilized egg begins to grow.
Good.
The moment it's fertilized, it's growing. And it can grow and outgrow the size of the lumen. And it gets stuck in the fallopian
I will
tube.
come back to the same question.
That is what results in ectopic pregnancy.
Ectopic pregnancy. Outside the uterus.
Yes. A pregnancy, the fallopian tube, the fertilized egg is trapped. It's not able to move because the movement is slowed down by the lack of the finger-like processes. And then, but it is growing.
It's growing.
It's growing. Then
So in
it
that
will
case-
burst the fallopian tube.
Okay. So in
And
that case,
then
you go for surgery.
bleeding will occur. And once bleeding occurs, it's a terrible problem. It's a serious
Can it
problem.
be cured by
the
surgery?
woman will have to
By
be
surgery?
taken to theater
Yes.
to
yes.
stop the bleeding.
Okay.
Yeah.
Okay.
So that is at the level of the fallopian tube. The fallopian tube can be blocked. Once the fallopian tube is blocked by disease, it's difficult for natural pregnancy to take place. Then you now come down to the level of the uterus. Fortunately, there are not so many problems that the uterus will have, because once the ovaries are functioning properly, every month they prepare the internal lining of the womb to receive a fertilized egg. Once a woman can, however, there can be problems in the womb that will prevent reception of the fertilized eggs. You know, like an abnormalities of the uterine cavity as a result of an abnormality of the structure of the womb.
Okay.
That can result in a baby not being able to implant. Problems associated with the internal lining itself, we call the internal lining the endometrium. And during pregnancy, the endometrium is converted by hormones to decidua. If that conversion cannot take place, then implantation will not take place. So there are so many problems. Of course, finally,
Yes.
you have to come to, when you get into the uterus, after the cavity, you are moving down, you have to go to the uterine, the cervical canal. The cervical canal can be blocked. If it is blocked, the semen deposited in the vagina cannot move up.
Reach. Yes.
So those are the common causes of infertility.
Now let's look at the age group that is more vulnerable. When you look, particularly when you are looking at women, you know, what are the most
We
vulnerable?
don't really have any vulnerable groups, provided the woman is in the reproductive age. Reproductive age, as defined by us, is a woman who is up to 15 years and a woman who is less than 49 years or thereabout.
Okay.
However, the age at which menopause occurs in women is not the same for every woman.
That's
Menopause can occur early, at the age of 38 or 39, and it can occur late, at the age of 58. In fact, the Guinness Book of Record for the oldest woman who achieved a pregnancy naturally and delivered naturally is 58. Now we have IVF. We can make
Yes,
a
I
woman
want to talk
who
about
is
that.
68 to have a baby.
To have a baby.
Yes. But she will not be having the baby with her egg. She will be having the baby with a donor egg. Yes. Yes.
So thank you very much. Thank you very much. Infertility, is it curable?
Yes. Of course it is curable. In fact, it's now such that there is no type of infertility that doctors cannot cure.
Good.
The problem is that some of them cost a lot of money. IVF, for instance, costs a lot of money.
Yes.
And like I said, donor eggs cures a lot of infertility. But you see, what we do as doctors is to first find out if there is anything wrong with the structural outline of the woman. and if the man is producing good eggs. If the seminal fluid analysis of the man is acceptable, we dismiss him. We're no longer going to, you are fine. You should be able to make your wife pregnant. Then we will face the wife and see how we can make her pregnant with the husband's eggs by manipulating her system and see how we can. And the commonest problem we have is a woman who is not releasing the egg. We call that anovulation. The egg of the woman is not released. And usually when the woman talks to us, we will know a woman who is not releasing her egg. Number one, her periods will not be regular.
Okay.
Number two, there is this ovulation pain which people tend to misunderstand. And yes, there is pain during ovulation. We know when it occurs. It occurs 2 weeks before the next period starts.
Is that what you call menstrual pain?
That's what they call. No, that's not menstrual pain.
What is it?
Ovulatory pain.
Okay.
Yes, menstrual pain is the pain associated with the release of the air of blood from the uterus.
Okay.
So, and the woman who is unable to release her egg, if we do some tests, hormone tests, the test will tell you that this woman has not ovulated this month. And those are the hormonal tests that we do, and they help us to determine a woman who is not or who is having problems releasing her egg.
Is there hope for such a woman at all?
Is
there hope for such a woman?
Yes. In fact, that is the one area we can beat our chest as gynecologists and say we'll be able to help you. We can make a woman whose ovaries are normal and whose uterus is normal and whose fallopian tubes are patent. We can make the woman to release an egg. There are medications we give that will induce ovulation, and we do that often. And then we can then even go on to monitor if our inducing ovulation was successful. And when we have evidence that it was successful, we can then tell the woman when to make love.
Okay, yes.
So that the released egg will be fertilized. And that increases the chances of the woman getting pregnant. So the ovary we can manipulate.
Very good.
The fallopian tubes, there's not much we can do. We cannot do anything to make the fallopian tube. Many years ago, we used to operate on the fallopian tube. If the fallopian tube is blocked, we do an operation, go to where it is, cut off the blocked part and stitch the normal part together. But the success rate of that operation is so low that even at that time, people were very skeptical about doing it. Nowadays, nobody talks about it at all because you have IVF. If a woman's fallopian tubes are diseased, fine, no problem. She doesn't need the fallopian tubes to get pregnant. With IVF, we give you a pregnancy, So, and that is where 1977, I think, or so, when the first IVF baby was born, and her name was Louisa Brown in England.
In England, yes.
If they tell you how many millions of IVF babies, they have lost count. They can no longer count. They can no longer count the number of IVF babies delivered in the world. Even in Nigeria, you can't count. In Benin City, you can't count.
Are you serious?
Yes. There are up to 5 hospitals in Benin doing IVF, including UBTH. And they are all the success rate is about the same for all these hospitals. The other problem is bloody expensive. That is the only problem. But IVF can, in the 80s and 90s, a lady in England who was 58 years old wanted to have an IVF. The British doctors denied her that she was too old to have a baby. And the woman went to the to the press and made a lot of noise about it.
Yes, yes.
And then she was going to Europe. She went to Spain. And when she got to Spain, they did IVF for her, and she became pregnant, twins. And she flew back to England. And at the airport, so you Heathrow Airport, where she landed, almost like opening. See, I don't get the level.
Let me ask you this, Prof.
Yes.
IVF can also be made possible through the man, the husband of the woman, or from just another donor.
No, it depends on what the seminal fluid analysis of the man is.
Okay.
If it is acceptable to the doctor doing the IVF, he will use the man's semen.
Okay.
You know. But, you know, just like there are problems with the woman that will require an egg donor, that's how you have problems in the man that will necessitate an egg donor in the man.
All right.
Yes. But they are so different problems, you know. But they exist. They are there.
They're there.
And the IVF doctors see them every day, you know.
Well, thank you very much. This is not a one-time shot. I should
Yes.
think so, because there are so many issues that we need to discuss. But
Yeah.
we have carefully chosen Professor Igebwe because he's an expert, as you could imagine, and as you could perceive, quite an expert, nationally, internationally recognized in ONG. So we must thank you very much, Prof, for coming.
Thank you very much
indeed
for having me.
Yes, we hope to see you again
Thank
for other issues.
Yes.
Now, this has been Women's Health on Providence Television International, and the topic has been fertility, just simple fertility. But there have been a lot of issues thrown up by this topic. Professor Alfred Ehigegba is the co-founder Ebony Medical Center here in Benin. So it's nice to have had you on our program, Handshake.
Thank you, sir.
Thank you very much. Thank
Yeah.
you very much, Prof. My name is Emmanuel Egariba. I'd love to see you again. Please, if you want more information, make your comments available. We'll pass them on to Professor Egegba. If you want to log on to us, just simply go to YouTube and type in Providence Television International. You'll get us there and we'll partner together. Thank you very much.
Thank you.
Bye now.
Thank you.